My name is Colleen Nelson. I'm a radiologic technologist. I've been working in medical imaging for 26 years now. We're involved in many different capacities. I image patients in multiple ways with fluoroscopy. I do traumas, emergency room, inpatients, outpatients, with both stationary and portable equipment. I chose to pursue with an associate's degree. You do need to have either a 2 or a 4-year degree in order to become a radiologic technologist. But you can also continue on your education and get your master's degree and become a radiologist assistant. You may be able to volunteer or to inquire about becoming a radiologic technologist assistant. Those are people that support us. Supportive personnel are essential, retrieving patients and that kind of thing. But in order to become a radiologic technologist or an X-ray tech, you do need to have your degree. For actually X-ray technologists, they've done away with the certificate program, which was a technician. So you do have to have a minimum of a 2-year Associates of Science degree. And once you finish your schooling, you do need to sit for our boards and become registered. You're required to at least have 24 continuing education credits every 2 years, and that's what requalifies you. So when I was 18, I found a breast lump, and I was really upset and really scared. My family has a long history of breast cancer, and when I relayed my fears to the technologist that was doing my mammogram, she educated me, she explained everything so thoroughly, and she was so compassionate. I knew I wanted to go ahead and do that for the rest of my life. My first year of college, I was pursuing other things in medicine, but I wasn't sure which one. And that just completely changed my course. I enrolled at Pennsylvania College of Technology. I got my prerequisites done, and from there, I got into their program. I was accepted and completed the 24-month program. I love helping people. Patient care is important to me. I also like reassuring and helping some of the families with their concerns and their questions when it's clinically appropriate. I feel the more that you know and the more comfortable you are with people, the more you're willing to disclose, and that always helps all of the people that are around you treating you in a medical setting. So with fluoroscopy, we do different studies to see the digestive system. We have you drink barium. Occasionally we do need to do barium enemas so that we can see the lower part of the bowel. But yes, lots of x-rays, chest x-rays, extremities. I go to the OR pretty frequently, just helping them to align the anatomy with whatever hardware they need to install for an orthopedic case. I'm all over the hospital. I'm in the emergency room, I'm on every trauma, I'm in the OR. I do portables up on the floor for patients that aren't stable enough to come down to our department. So I kind of get to know everybody. It's really it depends on your career choice. If you were to become an X-ray tech and work in a clinical setting, such as like an urgent care or a doctor's office or a pain management center, you would be in one department. I chose the hospital just because I like to interact with a lot of people and see different things. So it's really important that you're able to keep a clear head, especially during stressful times where everybody seems to be panicking around you. Compassion, empathy, essential. You have to be able to adapt. Our patients have all sorts of needs. You're not able to kind of cookie cut any particular procedure. You have to tailor it to what their abilities are and remain vigilant in communication. You need to have good listening skills. I always felt I was compassionate, but you hone those in with experience. When you start to be able to guess what people may need, you kind of are able to get them the questions that you need the answers to tailor their care. biggest piece of advice, take as many of your science classes as you can. If you can get into any AP classes, take them. Physics, if you're able to grasp physics and learn about physics and really enjoy physics, it's going to come in handy and help you for the rest of your career. You can become a tech and be tutored for those specific math classes. I personally had a difficult time with math, but I was really blessed to have a professor that explained it as a language. I'm all about talking. Once I understood it that way, it became a little bit easier. I feel like if you're able to make sure that you have good listening skills and you're able to go out of your way to understand what somebody needs, those are the core things that are really important. And if you're bilingual or you speak multiple languages, that is such a bonus. It makes communication with your patient and their family so much easier and personalized instead of having to use an iPad or a language line or something like that. Big asset. So X-ray techs aren't limited to just a hospital or an outpatient setting. I was very fortunate to be able to do some clinical research for clinical trials. I worked with different pharmaceutical companies and presented internationally. I started technical writing, presented activities for the ASRT, which is who we get our credits from. And those things were incredibly enjoyable for me. I enjoyed learning about them, teaching other people about them, and finding out more about the clinical trial aspect of imaging. I also worked with a gentleman that worked on Hollywood sets, movies and series. He was their technical advisor on how to hang images and how to go about doing an X-ray tech's job in fiction. I did probably 3 years of clinical trials prior to coming here. It was always interesting to me. But I came back to the clinical setting because I missed the action, to be honest. Never let your curiosity die. When your curiosity dies, you stop learning, and when you stop learning, you stop growing. We're always going to have things that are important, and we need to balance our lives, but never stop learning and seeing what's out there, because you become so blessed to be able to see the experiences and to be able to use those experiences to help somebody else at a later time.